Those of you who know me also know that I follow this very closely. Fundamentals first, then pharmaceuticals. So I'm going to talk with you about some fundamentals, and that'll be the remainder of the talk today. So first, when we think about bones, a lot of people think mountains, like this is something cold and solid and rock. Maybe think about more interesting terms when you think about, yes, it's solid rock surrounded by life. But I want to change the thought, and I want you to think about that, in fact, bone is much, much more like a coral reef. It is a complex ecology that has multiple components. Focusing simply on calcium highlights important things, but blinds us to things which are far more important and critical that we all know about. So, specifically, I'm hoping that this living matrix we call bone, you'll see as much more than a mountain. Please think of your bones as a coral reef, a complex ecology that needs care and attention. And if we provide the fundamental supports, nature and its brilliance will take care of things. So, nice way of illustrating this is one recent publication looking at the combination of multiple nutrient deficiencies playing a role, and that there is an additive effect, low vitamin D, low B vitamin functioning, low vitamin K, all adds up, and there's kind of a synergistic worsening of bone health. Notice it has nothing to do with calcium per se, it has everything to do with the matrix and the context in which it's all taking place. So, I said specifically I want you to know about 3 take-home points from today about what goes beyond calcium for healthy bones, and also have anti-cancer activity. First, vitamin D. How can you come here at Plotnikoff talk without him mentioning vitamin D? But you've heard me speak 2 years ago on this topic. Vitamin D, vitamin D, vitamin D is fundamental to all of us. Those of us who live in Minnesota, we're kind of at a disadvantage. We can make vitamin D from the sun between the hours of 10 and 3, between tax day, April 15th, and Labor Day, early September, if we're not wearing clothing, if we're not wearing sunscreen, if we're not behind glass, then there's a good chance we can make vitamin D. But there's some other factors. If you've ever flown into the Twin Cities airport and seen a brown haze over the horizon, that's a vitamin D umbrella. So even a sunny day may not be enough. Additionally, the more color in our skin, the more sun we need to make vitamin D. Yes. So, people who work long hours indoors, there's all kinds of factors that go into why vitamin D is an important topic. Now, vitamin D is misnamed. It should be called a hormone. It's as important as estrogen, as important as thyroid, as important as testosterone, and they all share the same superfamily of nuclear receptors. They all modulate each other. Low vitamin D has been strongly linked to multiple cancers, multiple health conditions. It's just one of these fundamentals. 2,000 international units at retail price at Costco is 1.8 cents per day. Testing. The wholesale cost for a vitamin D blood level is $30. Can we get local oncologists to test vitamin D? No, they say we can't afford $30 in case insurance doesn't cover it. Okay. How do we know vitamin D is important for bones? Well, we know because of rickets. And rickets we think of something like a 19th century issue, but in fact it's actually a 21st century issue. Rickets all over the world is increasing as people spend more time indoors. as people are working, more and more women are going through pregnancy vitamin D deficient, multiple health consequences as a result of that. All I can say is, yes, vitamin D we know is critical for bones. Ensure that you have a good level. What is a good level? That's debatable, but the most authoritative body in the world is the Endocrine Society, and they say at least 30 nanograms per ml. The ideal is likely to be 40 to 60. That's what we know in 2019. We'll know more about vitamin D binding receptor issues. We'll know more about vitamin D metabolism issues. There's a lot more that we'll know in the future, but in 2019, I can tell you probably 40 to 60 nanograms per ml is going to be important. Now, when you hear people say, well, make sure you get 1,000 or 1,200 or 1,500 milligrams of calcium a day, I say, yes, but please recognize those recommendations were based on vitamin D deficient women. So if we take a vitamin D level of 20, which is low, and simply raise it to 30, calcium absorption will increase by 65%. Now, is that calcium going to your bones? No. Is it going to heart valves? Is it going to atherosclerosis? Is it going to kidney stones? Sure. What you need is, if you have a good vitamin D level, you need at least 500 milligrams per day. Too much calcium intake, no benefit. It's not going to your bones. Randomized controlled trials have shown that calcium supplementation is only slightly better than placebo for increasing bone strength. Its mission is to minimize bone loss.